So we're going to start this morning with a live interview with state lawmakers. And for that, I would like to introduce someone. If you're from the Capital District of New York, she needs no introduction. She's busy talking. She has been a news anchor and a health reporter in the Capital Region for 40 years. As if that wasn't enough, she went out and got herself a PhD and is now a certified health and wellness coach. But her claim to fame is that she is an actress and a singer and a SAG card holder. Dr. Benita Zahn.
Good morning. It is a pleasure to be here with all of you. So you will get my act today. We'll have some fun. You know, it is said, Betty Davis said, growing old is not for sissies. Truly not. Which makes it even that much more important that we have a structure that supports us as we age, that we have a government that supports us as we age, and that we have lawmakers who look out for us to support us as we age, so that every stage of our life is as powerful and impactful. And I really hate that word impactful. I had an old anchor who used to hate that, but really to be able to make an impact no matter how many trips around the sun we have made. But this is a partnership. And Lou outlined so much of what has come before to ensure that we get to this point well, but we have to keep going and fighting for that. Because if you lose just a step, we really lose miles. So we've got folks with us today who are just wonderful, who are involved in this. And let me do our introductions. I'm going to start because he's sitting right here. We've got Assemblyman John McDonald. He is the chair of the Committee on Government Operations. He is also, I've got a load of them. He's a member of the Alcoholism and Drug Abuse Committee, Health and Higher Ed, and Ways and Means. He's also a pharmacist in Cohoes. So he sees his constituents and understands their needs on a daily basis. And he represents the 108th Assembly District. That includes parts of Albany, Rensselaer, and Saratoga counties, including his hometown, the city of Cohoes. John, thank you for being with us today. Also with us is State Senator Cordell Cleare. She's the chair of the Committee on Aging and a member of the Committee on Social Services. She hails from Harlem, and that's what we were busy talking about when we got called up, because my brother lives there, and she's very involved in preservation, which can be looked at both ways, both in terms of structure and in terms of our lives and our health. So it's a pleasure to welcome you as well. And also with us is Scott Bendett, state senator, and he's on the committees on aging, insurance, and small business. And his areas cover parts of Columbia, Rensselaer, and Washington counties, as well as the town of Bethlehem in Albany County. And he reminded me that he was a wrestler, a very celebrated wrestler who knows my husband, who's a wrestling coach. So you know you want him on your side, because he's going to take on an opponent and not let go. So thank you all for being with us today. So we've got a range of topics we're going to cover, from the state budget to Medicaid, home care, new models of care, and then a little bit later, Congressman Paul Tonko will be joining us live via satellite or Zoom or whatever we're using these days to be part of our conversation. Y'all remember when Skype was a thing, you know? And we thought, oh, the visual on that isn't so great. But Oprah did it, so local news did it as well. And it became all right. But I want to start with the budget. Finally, New York State has a budget. The biggest budget ever, $254 billion. So I'll start with the big question, because I got plenty of specifics. You know me, guys. What's in it for seniors? A lot of money, but what's in it for us? John, you want to kick it off?
There's a lot of money in it, that's for darn sure. You know, from a healthcare perspective, which includes everybody, but of course includes seniors, it's about $37 billion, which is a significant amount of money. And by the way, that's matched with federal funds, so that gets us up there pretty significantly. The challenge is, where is it all going? And do we have 2 days to do this? Because we're going to need a lot of time. You know, arguably, and probably not happily to this group, a lot of the money goes to the hospitals and the nursing homes. They are very large interests. They have a large presence throughout the state. And to be honest with you, the hospitals, it's a dichotomy. The senator could probably speak more to downstate. In upstate, that's where Scotty and I represent. We can speak to the challenges we have up here.
I want to jump in just for a sec, because you and I chatted a little
Yeah.
before we started, you know, and my note says lots of money
Lots of money.
for SUNY hospitals.
Yeah.
500 million for financially distressed, which would mean everything north of the city, basically. And is that enough? I mean, does that even begin to touch on it?
So distressed hospitals is kind of an interesting dynamic because, quite honestly, I've never met one that's not distressed. They're always distressed. And really, it speaks to the larger issue of hospitals are changing. Their bread and butter, where they made their money, was on outpatient surgery. And as you know, many of you who have knees and hips replaced, which as we're growing older, they're both getting replaced, prefer to do an outpatient center, which is quicker. It's actually probably safer in regards to not getting nosocomial infections. And by the way, the insurance plans like them and the patients like them because they're less expensive. So the problem is the hospitals, which are critical parts of our community, are struggling financially. They are losing their bread and butter. They're relying more and more on Medicaid as a payer, and Medicaid and Medicare are never the best payer, the worst. So we keep putting more money towards them, but the distress is really based on how many days of bills do you have left to pay? How many days of money do you have left to pay? And usually the alarms start ringing when they're down to 5 days. 5 days. And then it probably takes 6 months to get the money. So it's a very broad term. They all touch it one way or the other. We put in billions of dollars a year to support these hospitals, but my personal frustration is, and I love the hospitals, don't get the wrong message, but do we know what we're getting out of it? And that's the challenge.
Yeah. I don't know if you two want to add on to that, or there's so much else in the budget that we could talk about. Cordell? That's always the toughest part of the whole day.
Finding the mic.
That's right.
Well, good morning. It's really an honor to be here as chair of the Aging Committee. There is some good things in the budget. There's a total $53 million for aging services. This is the first time that the executive has put in this amount of money, and that's designated to really fill the waiting list for non-Medicare clients. And it's not enough, but it is a big contribution and the biggest we've been able to get so far. So that's going to help a lot of people who don't qualify for Medicare and they really need the help. They need food services, they need care. You know, imagine if you're just making $5 over what the threshold is and you don't qualify. So this is going to be very helpful in our state for non-Medicaid home and community-based services. There's also, and I don't even like to talk about it, but it is an increase. You know, there's a 2.6% targeted inflationary increase for human service workers. A big part of aging is the care that you get and people being able to care for you and get paid for it. This is not easy work. And many of my families that do this kind of work are going out every day to take care of others and cannot even take care of their own families. And that's something that we have to really improve on, but there was a 2.6 targeted inflationary increase. There's also $1 million for naturally occurring retirement communities, as well as neighborhood naturally occurring retirement communities. So that's a total of $2 million that adds to the 8, and that's $10 million. That's important, and it's probably one of my favorite pockets of money that's allocated, because that really helps people age in place, age at home, age in their community, surrounded by family and friends and things that are familiar to them. And I think that's really the best way for folks to age.
And you know, you got to be fed.
Yeah.
And $23 million for the hunger prevention and nutrition program. But the Nourish program is $5 million, same as it was last year. Give us a sense of how well, if this is even close to enough money.
No, it is not. You know, the aging is a portion of the population, and you're the fastest growing population, part of the population in New York State. But the same challenges that everyone is facing, it's not like it's just, you know, young people who have food lack and have food insecurity. It's across the board. Rent is a challenge across the board. Prescription drugs is a challenge across the board. And it becomes a greater challenge, I guess, for our aging community because, you know, your salary doesn't go up. You know, it's kind of, that's where it is. It plateaus to where it's going to be. So we have to be mindful of all of these challenges that are happening. And no, it's not nearly enough. There are so many people who are going without enough food and going without proper food and the diet that they need to be healthy and maintain themselves.
Which is so critical to healthy
Good health.
aging.
It is critical to good health.
I'm going to bring you into the conversation now, Senator Bendett. I'm sorry, Assembly Member. It says you're in the Senate District, is what it says here.
I think it might be a mistake.
Show up here, Jeff.
That's
It's
it.
okay.
Yep.
I know what party he's affiliated with, but you know, GIGO, you know what that is, right? Garbage in, garbage out. No, it's Assemblyman. There it says it underneath that, but I see it. We're all good. We're all good. Which is why I'm going to ask you about mental health, which is a huge issue. 196 million was included in the budget, with 160 million to add 100 inpatient beds. A start, a drop in the bucket, and
Well, like everything that we're talking about right now, it is, I think as you just referenced, a drop in the bucket. Seniors pay about 40% of our taxes, receive about 1% of the benefits. Every county has waiting lists for various services and programs, from transportation, indigent services, a variety of different things that we provide, community programs that we provide for our seniors. As far as mental health goes, it's the same thing. Obviously, we're involved in a mental health crisis. As the senator just said, one of the fastest growing, if not the fastest growing segments of our population are women over the age of 80. And it's unfortunate that they're stuck in poverty as well. We're pretty lucky. We live in a little bit of a insulated area in the capital region where a lot of our citizens either worked for the state, hospitals, universities, and have defined benefit plans, pensions that help assist them throughout their aging process. But as far as mental health goes, which is what your question is that when you're isolated and you're lonely and you can't get out of your house and you can't, like you say, work out and be fit, those are all, things that contribute to depression. And it's really sad when we are unable to provide these services for our seniors. And it's one of the things that I'm really proud of, being from Rensselaer County and where I started in politics 8 years ago. And we made a commitment to building senior centers and refurbishing all the senior centers so that seniors would have a place to go and congregate. And that was really important for us, knowing that the seniors were left behind in the state budget.
And there's $1 billion was allocated for the safety net transformation program. What does that mean?
So that's a program, it's been around for years. This is like iteration 5 or 6. And it's usually $1 billion, $2 billion to help these hospitals in safety net areas. So it could be in some of the urbanized areas. It's also in some of the rural areas in upstate New York. And it allows them to make capital investments. It's not operating aid. You know, the money we talked about earlier was increased in Medicaid rates for operations, right? To help the day-to-day. But this is more geared towards helping them make strategic investments to help improve efficiency and hopefully to either expand services that are needed in the area, maybe retain services needed in the area, or to make sure that they operate more structurally sound.
I'm going to move now to CDPAP. And so it begins.
At least it didn't start, but it.
Yeah. Major change in the consumer-directed personal assistance program, shifting to a single statewide fiscal intermediary. And it's a big move, and it's not one that hasn't come under a lot of fire with some challenges to make the move. And it affects hundreds of thousands of consumers in personal care aids. So what steps are being taken to ensure that all this doesn't lead to a disruption in service or a decline in quality? And I'm going to add a little caveat. I covered that story and the battles for it for years. And almost to a person, folks who utilize it, their big fear is that in the end, this will land them in a nursing home and end their independence and their quality of life. I just heard it. I emceed an event for an independent living center of the Hudson Valley 2 nights ago, and I heard this. So go ahead.
I'll
Cleare
start.
it. Yeah, Cordell, it's all yours.
I can still be a lady about this one, but I staunchly advocated for the repeal of this and reform. I mean, for lack of any better understanding, I just don't know what covenant the executive made with the devil that this had to be done. It baffled and remains baffling to me, and I'm very afraid, and I don't want to be right about this, but I'm very afraid that this may cost people their health and quite possibly even cause people their lives. And I just think it was just ill thought through. I don't know what this great level of fraud is that we're trying to protect people from. I would really love to see some kind of an audit when this is done, and whether or not the ends justifies the means, because there's many faces to this, but 2 in particular is people being without care, like you alluded to. And there's also, again, there are people who are employed, who are working and not getting paid. And these are the people who can least afford to not get paid, not to mention the structure of the insurance program that the health insurance that the workers are going to get, which basically covers nothing. This is very shameful, and it's something that I just protested every single step of the way. I don't know why it had to be done in the budget, why it had to be done right now. This is a type of move that requires much more thought and much more input, and much more being much more careful about the steps that we take. So I don't know what to tell you other than I'm going to continue to be an advocate for the good implementation of this, and I'm going to be watching to see exactly what happens with this, because I don't want lives to be lost.
Yeah.
You know.
Scott, yeah. Scott, if the new model doesn't deliver on quality or cost savings or both, are there provisions in place to revisit and revise the law?
I don't believe so. I think CDPAP is a great program For me, I have a disabled brother-in-law, who's a physician, and unfortunately, he was a heroin addict, had a stroke, and it's been a burden on our family to take care of him. We're blessed that he didn't pass away or anything, but this program has been a lifesaver for him to be able to have independent living. My mother-in-law is 93, and it's the same situation. And so I watch this from a different lens. When we think about elder law, sometimes we only think about old people. And the fact is that we do have, people who are developmentally disabled, physically disabled, that, also are in desperate need of these services. Senator brought up about the DSPs, daily support professionals, only being paid a 2.6% increase, even though they advocated for nearly 8% increase, which sounds like a lot of money. The problem is a lot of these people are living in poverty. For my situation, when my father was towards the end of his life, my father was lucky enough to have long-term care insurance. And because of that, he actually had a DSP, stay with him. That DSP was actually his best friend because of, family situations. My mother passed away at 50, so he had a second wife, and she wasn't very enthusiastic about visiting him. So, this DSP was literally his best friend. And it's really shameful that we have these people that are taking care of, as Senator said, our most vulnerable people at their most vulnerable times, and yet they have to have food pantries in their facilities to make sure that they can eat right. So, this CDPAP program needs to be addressed. It's really helpful. It keeps people in their homes. My brother-in-law now is faced with going into a nursing home, and he's scared. It goes back to the mental health with the depression. And CDPAP really has given people a lease on life. And it's really sad that the governor changed the program and has negatively impacted it.
Go ahead, John, because I was going to add to you're applaud when you want. Go ahead. I'm just going to stop it. Because part of the ongoing conversation in this, John, is also if it doesn't deliver, how is the legislature listening? What mechanism is there for voices to be heard to then minimize negative effects? And we already know that there's been a snafu in payment. We know that.
No, there has been. No doubt.
Although they say no, we're making it up.
It's very
Yeah.
interesting, and I don't want to be the skunk at the party here, but I've had probably a half dozen constituents reach out. And I also see a lot of people that are working. They're taking care of patients. I see them in the pharmacy. And it's been quite the education to me. The program is a good program. I'm looking at Beth, who used to be the director of Consumer Direct Choices. It's a fantastic program. Matter of fact, New York State is probably the best adopter in the country. According to briefings we received, 43%. New York State takes in 43% of the federal dollars to support this program compared to other 49 states in the country. It's kind of interesting, isn't it? So we have a lot of people participating, which is good. At the end of the day, and I'm not trying to defend it, I'm trying to explain it. The intention was for New York State to get like the other 49 states and go down to one, maybe two or three facilitators, middlemen, the invisible people who are doing the paperwork behind the screen. And a lot of them are very good providers. But there's also some bad actors too. And unfortunately, this was supposed to be changed in 2019. I kept telling folks that it's got to change. And a lot of the nonprofit providers stared at me and said, we know it has to change. We're just afraid of what the change is going to be like. So we are living through it. I'm not going to stay in the past. Going forward to your question, there's a couple different things. One thing that myself and the Capital Region members requested of the Department of Health is to take consumer-directed choices, which is really one of the few statewide nonprofits, to allow them to be there for the last mile for the patients that are still not signed up. The ones that are not signed up, either one, I think it's very rare, don't need it, which I don't think that's the case because it has to go through an approval process, or two are the most difficult to reach. And that's where consumer-directed has a large role. The other aspect is This originally started because of our friends at the Independent Living Center. They're the ones who brought this idea to the forefront a long time ago. And they've been included, but not to a level that we think they should be. And quite frankly, they cover a large part of the regional footprint. Maybe we need to embolden them to be in a much larger role with the statewide contractor. The reality is the ship has sailed. We need to deal with the issues. I will tell you, the biggest concerns I've heard, there's been very interesting. First of all, the MLTC plans, who actually had all this information, knew what was going on. They didn't really step up and share that information with PPL, which is not good. The fiscal intermediaries refused to share the information. And I say this for a reason. I still practice healthcare every single day. And we keep saying this is healthcare, that consumer directed is healthcare. Well, those of you who work in hospitals, nursing homes, pharmacies, doctor's office, OTs, PTs, every day patients move through the system. And they may be leaving you for whatever reason. Maybe they need more care. Maybe they don't like you. No one likes their cardiologist for some reason. They all think they're God, I guess. Well, they're holding a heart. But anyways, people move all the time. They leave pharmacies, they come to pharmacies. I see this every day. And you know what happens? There's a nice, soft, warm handoff and they move on. That did not happen in this situation. If anything, the people in the department, the state is the problem. We had no idea how the program operated. We had no idea what was going on. So what's happening now, to me, is not unexpected. Most importantly, though, is to make sure that patients continue to get the care and, more importantly, make sure people get paid. I am a little bit befuddled when people tell me, I never did timesheets, I never did timekeeping programs. That's a problem that I really don't want to explore. I hope that's the exception rather than a rule. But we have people now who still can't work with the app. So we got to make sure there's a workaround to help them because they got to get paid.
I mean, we've got 250,000 people who use CDPAP in this state, which then moves us on to the next question about Medicaid home care and aging in place, because that is so, CDPAP is so integral to that. Vast majority of New Yorkers, vast majority of people want to remain at home as they age. Let's be clear. What initiatives are you championing, Senator, to support that goal so they can stay home? I joke, everybody except I had a great aunt who couldn't wait to go to the nursing home. She thought it'd be more fun than living with my uncle.
Well, as I mentioned before, NORCs are very important, especially in densely populated communities where I live. You know, you have people who, you know, civil service workers moved into certain developments, and now they're all seniors at this point, and we have large concentrations of them, and the ability to make sure that we are providing services for them. Senior centers are very important and play a critical role in our communities. It's some place that people can come, they can be social, they can get information. In fact, right now, as I'm here, I'm also giving a webinar to seniors who want to write their resumes because many of them have approached me, some because they want to work and some sadly because they feel they have to work. But that's happening through virtually, and it's being broadcast into all the senior centers in my district. So these are the type of things that I want to see happen. We do a comprehensive senior day every year with over 2,500 seniors that come, older New Yorkers, I gotta stop saying seniors, that come and get every level of service, city, state, federal, that's available, and are able to directly speak with people from those agencies. I think we just have to keep on. The most important thing is that we have to make sure that aging New Yorkers are not invisible. And that is what has been happening all across. It's in our budget, it's across, and they are really the most visible and really the most important to our economy, just to so many different things. And we have to make sure that we keep them out in the forefront and everything that's affecting everyone else. We got $1 billion for housing. I fought in my conference to make sure that a portion of that is for senior housing. We can't just, we have to build for seniors because people's families are gone. Some people want to move into something that, but they want to be in their neighborhood. They don't want to be in a nursing home. We also have to do supportive housing. So I fought for a portion of that. Those dollars also to go for supportive housing and also money to make sure that we're maintaining the supportive housing that we already have. Some of our housing is falling apart. These are important and I've seen them work. I've seen people live long, meaningful lives in these type of circumstances. And the opposite is true often in nursing homes and when they have to go into other types of facilities. They're a part of the community, they're able to remain in the community. And those are the kinds of things that I'm going to continue to fight for to make sure the seniors have that option.
You know, which brings us really to a comment that Scott made about long-term care insurance. And it started great. And if anybody has purchased it, you know that every year the premiums go up and up. And in order to maintain the ability to pay for it, you begin to back off on the services or it will kick in to utilize. What legislative solutions are being considered to help people afford the care while staying in their communities?
Well,
I know, do we have a week?
you hit it right on the head. I mean, we lead the country in out-migration for our state. So what do we have to do for seniors? Why do they leave? Why do people leave? What we want to have is intergenerational communities. We want to have communities where kids get to grow up with their grandparents. They have an affordable life. So the governor held these town halls all over the state. I went to a couple of them. And these town halls were riddled with, in my opinion, activists who had certain agendas. It wasn't filled with, to me, you know, people that had issues that I heard when I went to senior centers throughout my district, to senior living areas like Livewell in Delmar and Skodak. And what I found was that seniors cared about a few things. Number one, affordability. Again, I mentioned it earlier, we're pretty lucky in our area that we have people who have some defined benefit plans that help them stay in our area because they, you know, obviously get a check. We have a situation where people who are on fixed incomes are constantly having to make decisions about where to spend their money because it's a little bit unaffordable for people to live here. The second thing that people want is recreational opportunities for seniors. So why do people leave? You know, they can sell their house, they can move to Florida, they can move into an apartment that has amenities for seniors and they live this great life. So what do we have here? We need to come up with outdoor and indoor recreational opportunities for seniors. And lastly, we need to make sure that we have transportation for seniors. Because once you stop driving, that's when things kind of change. So to me, those three things are really very important. And then I'll just put the last thing out there, which is developing a statewide EMS program. So, you know, and again, I don't live in Harlem. I don't live in a dense area. I live in the opposite of a dense area. And so, and I've brought members from New York City to my house and they've asked me all kinds of questions as to how long would it take for the police to get here or an ambulance. And I'm like, I've got my own AED at my house. My wife's a nurse and my dad had 7 bypasses when he was 39. So I didn't want to take any chances. But, you know, all kidding aside, you know, we need to come up with solutions for people instead of just kicking this can down the road and letting everybody leave.
Yeah, John just said to me, he goes, nobody's saying I want to go back to New York to age out here. Because we don't have all that stuff. John, as long as we're there, there's been discussion around a public long-term care insurance program funded by payroll deduction. Do you support this? And what are the advantages, disadvantages?
I don't really have a firm opinion on it right now. Part of the single-payer health plan that is well-intentioned is now incorporating the long-term care component too. To be honest with you, and I've, one of the few members in the majority that are not on the bill only for this reason. I think some days, if you want lower drug prices, I don't know if you saw President Trump's executive order the other day about lowering the prices. Well, that's only happening in countries that have universal or single-payer health because the government does negotiate the drugs.
Right.
It's kind of interesting that he's pushing something that usually it's associated with the far left progressives, right? There are merits to single payer, but we're not going to get there anytime soon because organized labor doesn't support it. But more importantly, we don't have a partner at the federal government that's going to support that. And I do want to take a moment, I know we have a little bit of time. We, as much as the CDPAP has been disruptive and challenging and anguishing and no one's happy about it, per se, at least we only hear from the people who aren't happy. We never hear from the people who are happy. This is only a little symptom of what's to come. The proposals being contemplated at the federal government. And Lou, this is great that this is a statewide program because it's my opportunity to share with the fact that, those of you who live in areas that are represented by a majority member in Congress, I hope you're picking up the phone and letting them know we can't have any cuts to Medicaid throughout this country. I am actually, we're lucky we get to follow this both from a policy perspective and a political purpose every single day. And I'm surprised that some members are actually not worried about this when I look at the numbers of Medicaid enrollment and find out they have higher Medicaid enrollments in their districts, congressional districts, than we have here in the capital region. And I'm like, who are you representing? The reality is this, we're probably not going to get to single payer in my health time. However, we can responsibly expand coverage to make sure that we're capturing the people, obviously at the youngest of all ages, but also as we get closer. And maybe we can close the gap a little bit and provide comprehensive coverage. But I will say this, Coach, it's best that we all focus on living healthier. And that's where Scotty's comments about these recreation centers, Senator's comments about the other social determinants of health in regards to providing reasonable housing, access to food, opportunity. That's not sexy. It's not something you see, right? We see emergency room backups. We see people waiting on nursing home lists. We see that. But what we don't see on a daily basis is people with their silver sneakers going to ABC gym and exercising and doing their things, maybe actually using their SNAP benefits to get healthy food choices. We don't see it because it's not newsworthy, it's not exciting, but that's what we need to keep reinforcing. And it's interesting because it doesn't get the attention it deserves.
Then I'm going to have to talk to the congressman when we bring him in because I'm nationally certified, sat the big exam as a health and wellness coach, and insurance won't cover me. So if we're talking about prevention and not letting the horses get out of the barn, we have to have a wholesale rethinking as to how we approach health care, not sickness care. Very big thing. And I want to, because you've been talking about the money, the wages for the care providers, and at what, 2.6% increase. Help us, share with us what it is you are doing to keep sounding the clarion call that they must be paid more because, with managed long-term care programs, they're often criticized for not providing enough hours, but you can't provide more. One, you've got to pay for it, but two, if you don't have the people to do it. So talk to us a little bit about that intersection.
So there's a lot to say there. But I want to just chime in. One thing I want to mention is, and I think Assemblyman, you alluded to it, the governor did go around the state and get a lot of input from a lot of people, good input. The master plan for the aging, some people may remember that. We'd like to see that released that is an important part of us moving forward. There was very good geographical information for every part of the state, and it's time for that to be released and enacted on. And Assemblyman, I just want you to know I have a bill that calls for the sustainability and the viability of senior centers in every area of the state. So I understand, and I do.
I'm really
know
glad to hear
the
that.
transportation concerns. I've been visiting, and I didn't mean to exclude that at all. In terms of salary, we have to, first of all, people don't even want these jobs, okay? I actually have a pilot program that I started when I came into the Senate. It's called Skill Spring. And I partnered with a program, a nursing home in my district, the Jewish home, and actually got some money put into this because they are training high school students to become CNAs. They have, it has been very successful. There's been at least 6 cohorts that have come out, and as they graduate, they are guaranteed a job. These young people are now working in nursing homes across the state. It has become a pilot program for the entire state. We were able to put in a little more money this year to do a little bit more, and I'm hoping that it grows and grows and grows. This is the age that we have to get to people if we want them to be in this profession. At a young age, it's helpful to the young people and it's helpful to the nursing homes because everybody's looking for nurses. Everybody's looking for caregivers. Some of these young people, they don't remain CNAs. I already have them calling me, telling me, how can you help me? I want to be an RN. I've got a few of them in Lehman College already. It's a great pathway and a great pipeline. So we have to create pipelines and opportunities and pay for it so that people can get the education they need and the skills that they need. And secondly, as was mentioned before, we've got to put a priority on paying people for these services. We have to make sure that their cost of living is taken care of. These jobs are not jobs that people are taking to get rich. These are not jobs even that people are only taking for a salary. They care. They care. You have to really care to do this kind of work. I have seen it. My mother did this kind of work. I have people that call me to this day, and someone would think they were my blood family members because these are people that my mother cared for. This is something that we have to put a focus on, and I'm going to continue to always ask fair pay for home care. We're going to continue to fight for that every single day. We have to put our money where our mouth is. If we say we care about seniors, we have to do the work to make sure that we show that we really care about seniors and pay the people that deliver services to them.
Do we have any questions out in the, right over there? Or Beth, so we're just gonna make a quick run, or you're gonna stand up and really speak with your outside voice?
And what I can share with you, a little perspective from firsthand knowledge, is that DSPs can make more money working at Aldi's or Trader Joe's. We have lost so many people. I've heard from families that whose individual children need, or adults for that matter, need assistance, and they are losing people due to the fact that it's so much easier to get a job in retail. And they specifically cited Trader Joe's and Aldi's. So we really need to push more than just 2.9% or 2.6% to increase, because we're losing people. We lost people through COVID. There is such a huge shortage. I have parents asking me all the time, do you know of anybody that can work with my child? The same thing for adults. My sister's a care manager for seniors. She has the same issue. There's a higher demand than there are people to fill the positions. I have a colleague that works at the ARC up in Saratoga. They need higher wages approved to pay these people. Medicaid needs some reform. So I just wanted to kind of share input from somebody who works in the field. I have an older sister that works in the field with seniors. I work with students with disabilities. That's why I'm here, is to raise a voice and make it aware that we really need to do some more searching for funding to get people in these programs. Now, the positive I will share is that our Capital Region Career and Technical Schools, they have a CNA program. They have a PCA program. So people can recruit right from there. And they would love you to come and visit. The teachers would love that and know that there's a place for their students to have a job waiting for them.
Thank
I
you.
want to
Thank you very much.
On
Please,
a couple of things you said there, because you're absolutely spot on. I'm not going to get into the fact that with the former governor for 9 years, we couldn't get 0.1% increase. I will say to Governor Hochul's credit, and because of the staunch advocacy on both sides of the aisle in both houses, very mindful of. And it's sometimes it's a politically fraught conversation. Yeah, people are kind of like, oh, the border crossing. A lot of these undocumented immigrants are coming here for an opportunity to create a life for themselves. And they have been you talk to any hospital or nursing CEO, you talk to any CEO of any of the other facilities that care for individuals with development disabilities, they would gladly embrace these individuals if they come. And, for the last year, the border has been shut down. I think there's a lot of politics going on how things are being misaligned, to be honest with you, because we need more people coming to this country to take on these jobs, plain and simple. And one more shout out for the BOCES program that she's talking about. It's fantastic. Scotty and I work with Questar and Capital Region, their New Visions program, getting these kids in juniors and high schools interested in these type of programs are fantastic. They're absolutely fantastic. We can't grow them enough. And finally, the education department 2 years ago woke up and said, hey, you know what? Not every kid wants to do math and science. Maybe we need to start looking at that. So the education department as well is starting to support
And
that.
we added money for that.
Thank you.
We had-
I'm going to grab one more question and then I've got to wrap it up. Yes, please. Thank you.
I saw a model where a local town had housed college students in a skilled nursing home that had vacant rooms. And the only thing that those students had to do was spend 60 hours a month with the seniors in any way, having meals with them, sharing a conversation, providing support that they needed. Is that a model that can be looked at? Because that can help the college students as well as the
I
seniors.
think absolutely. I just want to quickly just say before John, at Van Rensselaer Manor, I know that they had to close a wing because they didn't have enough staff to work there. And now people can't go in there because they didn't have enough workers. So that is a possibility to look at. And I'm glad to, look into that and see if it's something that we can do locally.
Yeah. But at the heart, and I'm going to have to say thank you, at the heart of all this is valuing seniors. If we don't value seniors, we don't value the people who provide the care for them. And this is an ongoing issue in this country. So our voices, I'm over 55 kids, have to be heard. And if you're lucky, you will be over 55. So your voice has to be heard. I want to thank you for the thoughtful questions we took. I want to thank our panel for their wonderful and thoughtful comments and giving us some hope about understanding the work that you're doing. Assemblymember Scott Bendett, State Senator Cordell Cleare, and Assemblyman John McDonald. Thank you. Go out and keep fighting the good fight. Thank you very much.